Today on Cancer Buzz, an award-winning model to leverage the electronic health record to automate selection of a biosimilar. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Today's episode is the first in our 6-part series on the 2024 ACCC Innovator Award winners. The ACCC Innovator Awards aim to highlight cancer care programs that improve access, quality, and value, and provide solutions that other cancer programs can replicate. Our guest joins us today to talk about their innovation, leveraging the EHR to automate biosimilar selection and streamline the prior authorization process. Sarah Hudson-DiSalle is a doctor of pharmacy and assistant director of infusion reimbursement services at the Ohio State University Comprehensive Cancer Center, Arthur G. James Cancer Hospital, and Richard J. Solove Research Institute, known as the James for short, in Columbus, Ohio.
Giving them time to spend more time with their patients and giving that care and taking some of the administrative burden off of them. But then also for my prior authorization team, it gives them more of a streamlined workflow. So it really removes some of the administrative burden for many areas of the team member. And so what we really want to show is what's been our path. How did we happenstance upon this, or the idea of this, and then how we brought that to fruition.
What challenges were you looking to solve at the James?
Authorization is probably one of the largest administrative burdens that most healthcare providers and clinics face on a day-to-day basis. And at the James, we were noticing that our payers had a variety of preferred agents for whether it was a reference product or a biosimilar, and they didn't have a congruous agent across the board. And so we were having delays in patient care. We were having frustrated providers because once we would submit for the reference product and get back then the request to change to a different preferred product, it was delaying patients by at least 1 to 2 days. And that was really the impetus for us of looking at, was there a way that we could electronically deliver the preferred agent to the prior authorization team without that intervention from our providers or the frontline pharmacists?
Who were the players on the team who worked on the project?
Really, this was a big team that we incorporated our pharmacy informatics group, our clinical specialist pharmacists, pharmacy administration, our prior authorization team, and even our medication access team, of coming together and having the conversation. And I should say, as well as our purchasing and finance group, of making sure that all voices were heard of, the opportunities that we had with biosimilars.
What do you think makes this effort unique?
The James has a long history of using opportunities to think outside the box to discover methods that provide better solutions for both our patients and our staff. This opportunity is a testament to such an effort. And by using an electronic medical record auto selection tool that takes into consideration those insurance preferences, contractual relationships, and providing that proactive solution has helped our pharmacists, our providers, and prior authorization staff do a more effective role.
You're going to present your winning program at the ACCC National Oncology Conference this fall. Tell us a little bit about what makes the NOC so different.
NOC, I think, is really an ACCC in itself, I think, has great energy. The multidisciplinary setting of ACCC and NOC, I think, brings in a variety of, viewpoints, ideas, solutions. And, this is a great example of, how a solution touches a lot of different disciplines and how it has that impact for those areas. And I think NOC it brings kind of the best. It doesn't matter if you're a small group or a really big group, there's bits and pieces that you can take home to your practice that really elevates it up to that next level.
Hudson-DiSalle will present Leveraging the EHR to Automate Biosimilar Selection and Streamline the Prior Authorization Process at ACCC's 41st National Oncology Conference, which will be held October 9th through the 11th in Minneapolis. You can find a link to register in the show notes. Make sure to follow this channel so you're the first to know when we release each episode in this series. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.